Hello, everyone. Thank you for your attendance today. We are going to give a few more minutes for those still logging into the webinar today. So just hold on tight and we'll be right with y'all. Thank you. Thank you everyone for your attendance today. My name is Ameri Arias. I'm an admissions officer here for the online programs of applied learning at Johns Hopkins University Bloomberg School of Public Health. At this point, you should be able to see our screen with the first presentation slide. If you have any issues seeing the presentation start, please let us know by typing into the Q&A box. Today, we will be discussing our Master of Applied Science in Patient Safety and Healthcare Quality. Joining us today will be Dr. Albert Wu, a director of the Patient Safety Program, and myself. My name is Ameri Arias. I'm an admissions officer here for the online programs of applied learning. I work with our team to assist students as they're exploring their options for continuing education. I'm excited to be presenting with you, Dr. Wu. Could you please introduce yourself?
Oh, I am so happy to be here. And I'm Albert Wu. As she said, I'm a professor of health policy and management, and I run our Center for Health Services and Outcomes Research here in the Bloomberg School of Public Health. But most importantly, I am director of the Masters of Applied Science in Patient Safety and Healthcare Quality.
Thank you, Dr. Wu, for your introduction. To give everyone an idea of what we'll be covering today, Dr. Wu will take us over an industry overview. He will go over the program details and curriculum. This program is fully online, so he will give you an insight as to what it looks like to be in online learning here at Johns Hopkins University. Faculty will be highlighted. I will go into admissions requirements, tuition and financial aid, details about the scholarship we offer. We will save time for a Q&A at the end. So please feel free as you are listening to this presentation. If you have any questions, please type them into our Q&A box. For those questions that come in, we will cover those at the end with Dr. Wu. Thank you so much for your time and attending. Dr. Wu, please feel free to.
Thanks for handing off. So let me talk a little bit about the profession of patient safety. Peter Pronovost, who was the former director of our Armstrong Institute for Patient Safety, once said, organizations profess patient safety as a top priority, but they're still figuring out how to manage it with the same rigor, discipline, and accountability that they do their budgets. And I would say that at this moment in history, virtually everyone understands that patient safety is important. And now, perhaps more than ever, they are very interested in making sure that they can put people into positions in their institutions to improve and ensure safety. Data from prior to the pandemic, 100 years ago, or so it seems, are that in general, repeated studies worldwide have showed that 1 in 10 hospitalized patients are harmed in some way while they are receiving care. It's a staggering number, and it does vary a bit from hospital to hospital, but a huge proportion of people. There are at least 1.5 million preventable adverse drug effects in the US, and adverse enough so that they are recorded. Estimates suggest that the cost of unnecessary tests, the harm from misdiagnoses, and legal payout alone exceed over 100 billion a year in the US. Inaccurate diagnoses are perhaps the most common and catastrophic medical errors, though medication errors are also are perhaps the most prevalent. Next, please. So many frontline clinicians and their managers and top leaders are enthusiastic and are truly committed to improving safety. The challenge is that many institutions do not have the expertise or the personnel with sufficient training and basic scientific underpinning in areas that are necessary to implement safety analyses and intervention. So the concepts of patient safety and healthcare quality, in fact, could benefit all sorts of professionals, and they are necessary to hold a whole lot of possible job titles. I would say that every one of the titles that I will list are held by people who are currently students in our program, or are, and in fact, are people are in those positions and enrolling in them in order to get more information. And these are also positions that people assume after finishing the program. Director of Quality Management and Patient Safety, Patient Safety Officer, Medical Director and Patient Safety Officer, Nurse Director of Clinical Quality, Risk and Quality Improvement Director, Director or Vice President of Quality Management, Director or Vice President of Quality Outcomes, Quality Assurance, Patient Safety, Director or Vice President of Performance Improvement, Patient Safety Officer, or Patient Safety Consultant. I would add to this that as far as patient safety goes, this year has been a record year for those who are interested in safety and also have an interest in hospital epidemiology and infection control, as you might imagine. And there are jobs left and right for people with those qualifications. Next, please. So the program is a full Johns Hopkins master's degree. And without bragging, I will say that Johns Hopkins is the #1 school of public health in the country, in the world for that matter. And that we have more master's degrees and more master's students than any other program. This is one of that suite of master's degrees. But this one is a little bit different because it is not simply an academic degree. It's very skills-based. It is aimed squarely at working professionals, though some of our students, in fact, are people who aspire to work as professionals. It's intended to be taken part-time, and it's 100% online. The total number of credits is 48 and a half. This is somewhat less than some of our other programs, and it is intended in general to be completed over 2 years, each year comprising 4 terms, and each term including 2 courses on average. Those courses include lecture material, but also information and skills to help with professional development, and an integrative activity that pulls together things that you acquire during the course. So there are things that are online and asynchronous, but there's also group learning and peer assessments that happen live. And virtually all of the courses are skills oriented. There are projects, there are plenty of examples, there are plenty of hands-on opportunities. We would like to give people tools that they could use as soon as they acquire them. The focus is on public health. This is not a business degree. This is not an engineering degree. The focus here, this is not a management degree per se. The focus really is on public health. And the goal is to educate students on measurements of safety and quality, on designing safer systems, on accomplishing organizational and cultural change within institutions. There's a firm focus on patient-centered care, and the ultimate goal is to prevent patient harm. Next, please. Here's what the 2 years look like if you were to do the course in 2 years. Academic term 0 is simply to make sure that you understand the basics of the online learning platform, which I would say is pretty seamless, but you need to know how to use it before you start. There are a number of courses that are required to fulfill a master's degree in public health. So there's a small course on research ethics, but we've just finished our first term, and perhaps the main course is our science of patient safety. And there's also a seminars in public health course, which is oriented somewhat towards safety and quality. We've just started second term and are starting the introduction to quality of care for practitioners. And there's an interesting case studies course of some international and some US cases of organizations that are doing a particularly good job of managing quality and safety. The third term is really devoted to skill building and gaining some basic tools in epidemiology. The professional development workshop is on writing for results. And we all need to write memos, reports, and even publications. I think this is really very valuable. The fourth is devoted to establishing a foundation in basic statistical methods. And there's a terrific course on leadership for change, because what we are really training you to do is to lead on patient safety. Year 2, in the first term, there's again 2 courses. The second half of the biostat course, Statistical Concepts in Public Health. A really fun course on quality improvement tools, things that you might use, for example, how to do a root cause analysis, how to train someone in teamwork, how to investigate a problem. The second term begins with the second half of the epidemiology course and more seminars in public health. At this time, you will also already have begun to think about your integrative activity, which is in the last term. The third term, there is a measurement course, how to evaluate quality and safety, which I think is critical, and a now extremely popular infection prevention in healthcare settings course, taught in fact by our lead commander and director of hospital epidemiology and infection control at Johns Hopkins. The fourth term is largely devoted to an integrative activity, which pulls things together from the past 2 years worth of courses. And that is supported by a measurement lab, which can perhaps help you with some of the details of that integrative activity. Next, please. This is a truly and highly interdisciplinary course. It's perhaps the most interdisciplinary thing that I do at Johns Hopkins. The program is run by the School of Public Health, but in close collaboration with the Armstrong Institute and the School of Medicine, the School of Nursing. And I would also add our, I would say, industry-leading resources in online learning. We are now teaching over 100 online courses. Actually, we were teaching in over 100 online courses before the pandemic. Since the spring of this year, all of our courses have been converted to being online, and we have committed fully for calendar 2020 for all of our coursework to be online. The fact that we dedicated ourselves to do this in March and devoted all of our resources to this has allowed us to, I think, really do a good job. The courses are led by, I think, some of the absolute top experts in the field who are doing research, but who are also practitioners. We have been doing this, teaching this course online in some version or other, but I would say much until just a few years ago, we'd really been doing it one course at a time, but we've been teaching patient safety online for 20 years. The courses have great production values. The activities, I think, are engaging and fun, and it's remarkable how the cohorts of students wind up teaming up with one another, forming study groups, forming conversations that start at the beginning of people matriculating and run for the entire 2 years or even more years of the course. The fact that the basic lectures are recorded, I think, makes it much easier for busy professionals to complete them. There is, however, a help desk which is open literally 24/7 in case you have technical problems in particular. Next slide, please. We have an esteemed and really astounding faculty. I will only mention a few of those individuals. But Matt Austin is a PhD who, between you and me, runs measurement for the Leapfrog group as a subcontract to the Armstrong Institute. Renee Dembski is our Director of Operations for Patient Safety for the Armstrong Institute. Cheryl Himmelfarb is a dean these days and is a nurse leader in patient safety and also in cardiovascular epidemiology. Sydney D is a world leader in palliative care as well as patient safety. Lisa Maragakis, who I mentioned a moment ago, is the Director of Hospital Epidemiology and Infection Control, and she has been the lead commander in our unified COVID-19 Incident Command Center for all of Johns Hopkins Medicine, 60,000 employees. Jill Marsteller is an expert in evaluation, John McGreedy, a statistician, is one of the most entertaining human beings I know, and can help you to understand biostatistics, even if this is not something that you would consider among your favorite things. Laura Morlock is our Senior Associate Dean of the school and an expert on risk management. Lori Payne is the Director of Hospital Patient Safety for Johns Hopkins Hospital. Peter Pronovost, I think, is a world famous patient safety researcher and practitioner, and was the founding director of our Armstrong Institute. Mike Rosen developed Team Steps for the Agency for Healthcare Research and Quality. Melinda Sawyer is the world's expert on the comprehensive unit-based safety program. Kathy Sutcliffe invented high reliability and runs her course from our business school. This is really an extraordinary group. I think that we are very privileged to have our lectures and our courses delivered by the world leaders, the world experts in patient safety. Next, please. So I am going to pass back off. Do you want to pick up?
Yes, of course. Thank you, Dr. Wu, for all the insight for the patient safety program. For those of you that have joined us after the start of the presentation, please make sure to type in your questions in the Q&A box for our Q&A at the end. I do see some questions that have come in already. We'll get to that at the end of this session. I am now going to take some time to go over our admissions requirements. And if you are interested in moving forward, it is important to know what you need to know for the admissions process. All our applications are processed online through Sophus. To streamline your application process, the requirements for education is a bachelor's degree from a regionally accredited college or university. The professional requirement is a minimum of 3 years of work experience in the health-related field. A clinical background is not required. We do require a current resume or CV to be uploaded into the online portal, highlighting previous healthcare accomplishments. You will need 3 letters of recommendation. The statement of purpose is your biggest piece of your file, of stating to the admissions committee why this program, how this program matches up with your career goals, and what your educational objectives you're trying to fulfill, and how you hope to apply this in your career and in your future. For our international students, if English is not your first language, you may need an English proficiency exam. We accept either the TOEFL or the IELTS. For those who have obtained education outside of the US for your academic records, it is a requirement that you undergo a course-by-course credential evaluation via the World Education Services, which is WES, shortened out. Once again, World Education Services. I encourage you to review the WES required documents. That way you can see what is required from your university and how your university should send those records to them directly. We are used to working with students on this at the Office of Admissions. So if there is something you need or have questions about, this is something that you can reach out to us at the Office of Admissions, and we can get you connected to the right resources and websites to get you started in that process. Our application is currently open for the fall of 2021 start. We review on an ongoing rolling basis, meaning that you do not need to wait until the deadline posted on this slide to hear back from the committee with your decision. We encourage students to apply early so you can receive your decision early. The deadline to apply is June 1st of 2021. We are here to assist you through the application process. If you have any questions or concerns on the application, you have a support system with us. We only enroll one time per year, so it is important to know if you're excited about this program, we only have one start each year and our applications are open now. So if you're interested in starting in the fall of 2021, but not sure if you want to commit to a full course load, you do have the flexibility of starting one class at a time. To provide insight on the investment of school, right here is listed our financial information, as well as some information about our financial aid office for those who are eligible to utilize other financial resources such as FAFSA or private loan information. You can feel free to look at our website, email, or call them. The information's listed here. For the 2020-2021 school year, the tuition is $1,197 per credit. We offer an OPAL scholarship that is available for this program, which is a partial scholarship that covers $460 per credit, which leaves the student responsible for the remaining $737 per credit. This scholarship is specific funding to our OPAL programs, which is our online programs for applied learning. If you are admitted into the program, you are automatically awarded the OPAL scholarship. There is nothing additional that you will need to do for it to receive it. If you are planning financially, you will want to plan for the $737 per credit at the current tuition rate. Of course, keeping in mind our tuition and scholarships are reassessed each spring. Any changes will be updated on the website in the late spring. Just to go over the credit breakdown, this program is 48.5 credits at $737 per credit. Now for our Q&A session, we do have a couple of questions that have come in. If you have not submitted a question and do have a question, please feel free to type in your questions into the Q&A box if you have already not done so. Let's see. How much is the course for international students? So as I had mentioned before, it's $737 per credit. That's the per credit hour with the OPAL scholarship for all students admitted into the program. I do have a question here, Dr. Wu. I am a critical care RN. Would getting an MPH prior to the MAS be more beneficial? Is there an overlap? What are your thoughts on that?
So great question. And we have people, many people who, a fair number of people anyway, who are trying to decide between getting an MPH and getting the Masters of Applied Science in Patient Safety. There is some overlap, but I would say only some. And it really depends on what you would like to do with your master's program. An MPH is a credential for serving as a public health officer in many jurisdictions. But it's very broad. I would say that it is much more of a literacy degree in many topics, in all of the topics of basic public health. When you finish the MPH, you would not be qualified to step into a job in patient safety, which I think the mass program, we call it OPAL actually, which our program would prepare you for. So it really does depend. I think that it is more difficult to complete the MPH online than our program. I think that, again, we are designed exclusively for a working practitioner as a sort of the average student. So it really depends on what you want to do.
Thank you so much. I do have another question here. Is this course geared for patient-facing clinical professionals? Is this program still appropriate for someone who may be working in healthcare in a non-patient facing or clinical role?
Yeah, this is not designed to be clinical. And there's no requirement that, though I will say that, perhaps half or more of our students are people with clinical training. Not all of them are practicing. And many of our students are managers. Many of them, in fact, are in areas that, for example, risk management or evaluation or quality improvement, which are not patient safety, patient facing at all. So I think there is plenty for people who are not doctors, not nurses, for sure. We have pharmacists, but we also have people who do not have clinical care professions.
Thank you. I do have another question here. Can we stretch the program to 3 years?
So you can stretch the program to 3 years, you can stretch the program to 4 years, and you can start out with the plan to do it in 2 years, but decide that it makes more sense to stretch it out. An interesting thing which Ameri did not get into is that you pay tuition by the term, by the quarter. So and then you enroll for the next term. So you do not pay the entire 30-odd thousand in tuition up front and then take courses. You really pay as you go.
Correct. Thank you. I do have a question that came in. Can you please expand on the delivery platform for the program?
So Ameri, you may want to share this. This is an online platform which is run by the Center of Teaching, the Center for Teaching and Learning at Johns Hopkins. And it is, so we have a huge amount of experience with it. We've taught probably 100,000 students, honestly, using this platform. It is pretty easy to use. It's possible to do things live, and it's possible to do things recorded, synchronous or asynchronous. I don't know if you want to say anything more about it, Ameri.
Yeah, of course. So the platform is called Course Plus. We've been using it for over 20 years here at Johns Hopkins. And like Dr. Woon mentioned, it is 100% online asynchronous. So there's no set day or time that you need to log on as long as you're adhering to the professor's deadlines with assignments and so forth. So I hope that kind of helps highlight what that looks like for us. I do have a question as far as, is the Opal Scholarship immediately available to all? Once again, the Opal Scholarship is for all admitted students into the program. Nothing additional that you need to do for that. I do have another question for you, Dr. Wu. Has the program implemented and evaluated their program compared to the new NAHQ competency framework?
Oh dear, yes. So this, I could give you a long answer. Dr. Morlock, who is Senior Executive Dean in the School of Public Health, is in charge of all of our teaching programs. The School of Public Health in any given year graduates approximately 900 students who are in master's or PhD programs. All of our students are affected by the new guidelines. So this has been incorporated actually in a fairly clever way into the program. But we have been thinking about it for, beginning a couple of years before the guidelines actually hit.
Okay, perfect. A question on the project examples and the hands-on opportunities. Could you elaborate a little bit more on that? I know you mentioned that at the beginning of the presentation.
Yeah, so there are, because we are online, nothing happens hands-on on campus in person. However, there are exercises in many of the lectures and in all of the courses that people are invited to complete, and they're often done in small groups.
Thank you. How many students do you accept in the program?
So I can only tell you how many students we have accepted. This year we have we have nearly 90 students who enrolled as of September 1. The year before, I think it was something close to that, 85. The year before that, it was about 100. The very first year, we had a relatively small class of about 50. But there is no actual limit to the number of students we take. I would say that our philosophy is we take anyone who looks like they are qualified and could complete the program, and who could really benefit, whose career or personal development could benefit from enrolling in the program. So the personal essays that people write are really very important. I think they help us understand how this program will help people. I have been the director of some other programs. I directed our PhD program in health services research. And in that program, we might have gotten a couple, maybe 200 applications in a given year and accepted 3 people. This is not a program like that. We will accept everyone who is qualified and who could benefit.
Perfect. I do have a question in regards to taking one course per term. Can you change the courses per term as you progress over the span of the program?
You can. There are things where it makes sense to take one course before another. Certainly you need to take Epi 1 before you take Epi 2, and Biostat 1 before you take Biostat 2. And you can't take the sort of the 4th term applied project course before you've completed the other courses. But everything else, more or less, can be taken at any given time. So there's quite a lot of flexibility.
Perfect. This is a great question. Is there an active alumni network?
So there is an active alumni network, though I will say that we are in the process of sort of building that up. I have 4 co-directors for the program. And we are trying to figure out ways to expand our social media presence and to reach our alumni, who are a growing group now. We've got several hundred graduates, many of whom are running patient safety in various places, and others who can help people be introduced into the work world in patient safety. Something which we've already done is we've already had a couple of forums for our new students, and the next one planned is to include alumni so that current students can talk to them and see what's out there.
Perfect. Thank you. So I think you mentioned this earlier, but how long is each course in a term?
So because there are 4 quarters in a year, and that does not include a very short fall. The university has a short fall intersession, a winter intersession, and a longer summer intersession. So each course is really just about 10 weeks long. It's or even a little bit less. They're not very long courses.
Thank you so much. Another question I have here is, let's see, are hospital administrations discussing increasing the need for MAS prepared professional because of the increased focus on patient safety?
I can't say that hospitals as a group are discussing this, but virtually every hospital of any scale these days has a director of patient safety, or a director of safety and quality, or a director of safety, quality, and risk. It depends on the size of the hospital. So there is, while it is not a requirement, I think that the Joint Commission is very happy to see that hospitals have these roles filled, and patient safety and risk management is a required function for every hospital. So I think the answer is yes.
Perfect. Thank you. Is this program based on the American model system, more globally focused? Could you speak to that?
It's not really, so it is more US focused or more North American focused than anything else. We don't actually spend that much time describing health systems, and we try to include examples, including international cases, for example. I spent a couple of years working at the World Health Organization in Geneva, and still spend a lot of time working internationally, and as do many of our faculty. So we do have a an international interest also. I would say that every year, between 10 and 15% of our class are international students.
Perfect. Thank you. Could you elaborate on the time commitment for the program for the courses?
Yeah, so that's a great question. I think that a rule of thumb might be that every credit hour in a course would require 2 or possibly 3 hours of work per week. So that would include 1 hour of a lecture, and then 1 or perhaps 2 hours of additional work for each credit. So if it was a 4-credit course, you might be spending 10 hours a week working on it. It might be a little bit less in a week when things are starting up. It might be a little bit more in the week when you're writing your final paper.
Perfect. The networking opportunities, I think you kind of touched base on this a little bit more. Another question as far as the networking opportunities.
Yeah, I think that there are one sort of advertised advantage is that there are literally hundreds of people working in patient safety at Johns Hopkins. And as a student, you are free to contact any of them and ask them questions, get advice from them, and potentially even approach them to help you with some of your work. This is not a requirement for all of those faculty members, but they're all interested in patient safety. The Armstrong Institute, for example, has about 140 or 150 full-time employees who are either in the research or in the operations side for patient safety. And there are many, many more in the School of Nursing, in the medical school, in the engineering school, and certainly in the School of Public Health.
Perfect. Could you elaborate on what the admissions committee is looking for in regards to healthcare accomplishments or the intended audience for the program?
We don't have a sort of a model applicants. There are people who are interested in safety and would like an introduction, and are serious enough about it that they're willing to dedicate themselves to doing a master's degree in the program. There are a few people who have a personal experience or a personal commitment and are coming relatively early out of, have not done any professional school and are pretty early out of undergraduate training. They may be considering doing this before going into a healthcare profession. There are other people who are practicing practitioners, some for years, some for decades. There are a few people who are leading programs already and want more skills and more tools. So if you can show us evidence that you are likely to be able to complete the work successfully, because we really, when we accept people, we would like just about all of them to be able to succeed. If you can convince us that you can complete the work and that you have a reason, a story for why this is of interest to you, you are likely to get accepted.
Perfect. Could you elaborate on the integrative activity at the end of the program and how other students may have applied this in their workplace?
Well, so not everyone is working in patient safety, so we give people the option of doing something that is directly applicable to their work. It could be using questions or problems or data that they have in front of them at their work, and they could review or design a solution to a problem, for example. However, we appreciate that some people are not working in patient safety at the moment, and so it's possible to do a review or to analyze a situation without having the need for any of it to be from actual live data or current work.
Perfect. I do have another question as far as is the focus on more medical-based patient safety, such as infection control, epidemiology, or is it encompassing all fall prevention, day-to-day clinical patient safety, environment of care, etc.?
Yeah, I would say everything.
Okay.
It is really not clinically focused. I think that we understand that safety it includes a huge system with many, many levels and many components, and all of them are important. You may be particularly interested in one level or one corner or one component, and that seems perfectly fine to us.
Thank you. Is there a thesis in the curriculum for this master's program?
There is not. The integrative activity is intended to allow you to pull things together, but I would not call it a thesis by any means.
Perfect. How about the resources on questions on assignments? How can students gain support in their classes? Are there TAs, faculty contact? What does that look like?
So there are one or more faculty members attached to each course. There are generally 3 or 4 TAs in every course. People often the class is often broken up so that one of those TAs might be assigned more to you than others. Every student is also assigned to one of the co-directors to be their advisor for their duration of time in the program. So you sort of have a consistent faculty person who is there to advise you and perhaps help you, but more advise you about directions to go in. You can always ask questions to the faculty. There's also a very, very active chat, sort of discussion board, and I'm impressed that people help each other and themselves, by floating questions to the group.
Perfect. Thank you. The application fee. When you submit in SOFIS for the application, the fee is $140 for the applications. That is the fee. And we do encourage students to apply early, as I mentioned earlier, to get your decision early. I do have a question about cohort. So how many students do you accept in a cohort once again?
Yeah, so it's not, so there isn't strictly a cohort, because when you matriculate, you are starting in a group. This year, there are close to 90 new students, but not all of them are on track to do the course, the entire program in 2 years. So some of them have already made a decision, and a few of them will make a decision, I predict, in the next year or so, that they're going to stretch things out. So the group that you start with is not necessarily the group that you finish with. I will say that perhaps the majority, more than half of students will finish with the group they started with. So, and people do, there is a certain amount of cohort-ness. The reason I say that is that beginning a couple of years ago, we invited people. People were, at the time of graduation, people are invited to come to graduation, just like, I mean, any graduate is invited to come to graduation. But we designed a few activities for the graduating class of 2 years ago, 3 years ago, and 2 years ago. We weren't quite so successful this year. We did it virtually. But I recall 2 years ago, there was of the original group of about 48 students accepted, 35 of those people came to Baltimore for graduation. So most of them graduated in 2 years, but the majority of those 48 finished in 2 years, and just about all of them came to Baltimore, which was a little bit crazy because there was someone from Australia, and there was someone from Kenya, and there was someone from Nigeria, and there was someone from Germany. And people had obviously gotten to know each other over the course of the couple of years, and had great affection and admiration for one another. It was a real love fest.
Very nice. Thank you. I have one more question before we sign out. So it's time to wrap up. The demand for patient safety, how does someone go about finding a job with the demand?
So, I mean, I think it's not that easy, but there are postings. There's no single, job board for patient safety, in the US or anywhere. But there are many, many, many healthcare organizations, both hospitals, health systems, and then agencies and public health agencies. We do have some activities. We have periodic, each year we have sessions which include sort of ideas for searching for positions. But there's no single channel that you can use to find jobs.
Okay. And lastly, if we did not get to your questions, we will be connecting with you offline. One last question. There is, give me 1 second.
There was one question about human factors, which I answered in the chat. But I will say that the answer to that question is that a lot of patient safety is design. And so human factors are sort of, human factors thinking is integrated throughout all the coursework. A faculty member who I didn't highlight is Professor Aisha Gersis, who actually trained in Wisconsin with Pascal Carrion, who invented the SIPS model for human factors and patient safety.
Oh, thank you so much for clarifying that. And as far as any other questions that anyone may have, we have about a couple minutes left. Feel free to shoot them in the box for the Q&A. And I think that's it. I mean, we covered all the questions that have come in. I thank you all for attendance. If we didn't get to your question, we'll be connecting with you offline. Our team at the admissions office will contact you directly in the next few days and assist in answering those questions. If you want to connect with someone immediately, my contact information is on the slide here. Please feel free to connect. Feel free to use a scan code to move forward if you feel ready for your application. And we look forward to working with you all. And we have a dedicated admissions team who will work with you throughout the whole application process. Thank you, Dr. Wu, and thank you all for joining us. And we hope to talk to you soon.
I look forward to seeing some of you in class. Thank you for joining.
Thank you.